Okay, dear distinguished judges and fellow researchers, good afternoon. My name is Siwakorn Chanchalotorn from Faculty of Medicine, Chiang University, Thailand. I'm the representative of our research group, exploring key factors associated with the effectiveness of medical students worldwide in the internal medicine, obstetrics, gynecology, pediatrics, and surgery departments. Ward rounds. As you may know, ward rounds are broadly defined as a period when medical teams visit patients to discuss, examine, and determine details of medical care, including diagnosis, prognosis, and treatment planning. Medical students are integral members of these team members, making ward rounds are more than just a routine practice. For medical students, ward rounds serve as pivotal learning tool, playing a key role in medical education by fostering the development of clinical skills while providing real-time opportunities for students to engage in patient care and decision-making. Despite their importance, the characteristics and structures of ward rounds vary greatly across the medical schools, leaving us with uncertainty on how to maximize the learning process from ward rounds for the medical student while maintaining its effectiveness in patient care. Our literature review shows that factors affecting learning and effectiveness of ward rounds could be categorized into three main groups: the learner, the instructor, and the structure of ward round. Building on these foundations, our study aims to develop a valid questionnaire to assess the factors influencing the. Okay, so our study is an observational cross-sectional study involving fourth and fifth year medical students, residents, and staff at Mahalanakon Chiang Hospital. Data were collected using a self-administered questionnaire distributed to RedCap, which incorporated both closed and open-ended questions. The questionnaires content variety was evaluated using the index of item objective congruence through expert reviews, and its reliability was confirmed with conduct alpha and McDonald's omega. With the conduct alpha volume more than 0.70 was considered acceptable. Statistical analysis was performed using strata. A total of 56 medical students were enrolled and completed the instruments, comprising of 42.9% fourth-year students and 57.1% fifth-year students. The mean age was 22 years. None of the participants had more than 20% missing data. Out of 28 questions, 13 were removed due to ceiling effect. Descriptive statistics including the mean, 95% confidence interval, median, and range of the 15 final item questionnaire was presented in this figure. Reliability and reproducibility were assessed using the conduct alpha values for the subcategories and the summary score of the questionnaire, which went from 0.73 to 0.84. Coefficients omega also yield values between 0.72 and 0.84 for the viable subcategories and summary scores. So the preliminary results for what is the most important learner factor contributing to the effective ward round, as chosen by the learner, indicate that the interest in learning is rated as the most important factor at 62.5%, followed by having a good knowledge and good communication with teacher at 23.2% and 10.7% accordingly. Results from the instructor are not yet viable for conducting a comparative study, and students' academic performance for further analysis is still pending. The next phase would be to gather sufficient data in order to suit the pre-planned study design and yield further results. So in conclusion, with this data, we will be able to develop a trustworthy questionnaire that can assess the factors influencing the effectiveness of the ward round. Furthermore, this finding highlights the need to optimizing ward rounds by addressing key factors, including learner interested in learning, to improve learning and outcomes. Insights from this study will inform future curriculum development, ultimately enhancing the patient care. So this is the end of my presentation. Do you have any questions?
about the result. The figures should you have explained it to be more clear. So the most percent is the interest in learning of the student have the factor that associate the ward round, right?
Oh yes, this is the yes. So this is a preliminary data collected from the questionnaire, and we found out that the learners choose that they're interested in learning in the word route is the most these are factors that most affect the effectiveness of the word route.
Quantitative data to explore how to interest the medical student interest in learning, not in this period now of this study.
Sorry, I think the internet connection is unstable. Can you repeat the question again?
Okay. So it's very interesting about interesting in learning the result that has more percentage. Do you have the more qualitative data to explore how the student have to interest in learning about in the word round?
Thank you for your question. Yes, we have. We also collect the qualitative data to in each group, the learners, the instructor, and the structure of the word routes. But now the analysis of this qualitative data is still pending. So in the future, we will analyze the qualitative data to see that how the correlation between the qualitative and quantitative data